Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Iloperidone. Its brand name is Fanapt. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how iloperidone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe iloperidone. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does iloperidone work? Well, the mechanism of action of iloperidone is thought to be related to the ability to antagonize dopamine D2 and serotonin 5-HT2 receptors. In terms of indications or reasons we would prescribe this medication to a patient, we would see this medication used to treat schizophrenia. With respect to contraindications or reasons we would not be able to prescribe iloperidone, we just wouldn't give this medication to a patient who had a hypersensitivity to iloperidone or any other component of the formulation. Now what about dosing with iloperidone? So in the treatment of schizophrenia, the initial dose would typically be 1 milligram orally twice daily. We would titrate the dose slowly, not to exceed an increase of more than 4 milligrams per day, and the target maintenance dose would be 6 to 12 milligrams taken twice daily, and the maximum dose would be that 12 milligrams twice daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using iloperidone, so I'll go over some of those here now. Orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, may happen 3 to 5% of the time. 3 to 12% of patients may experience tachycardia, or a rapid heart rate. 1 to 9% may experience abnormal weight gain, and 26% of patients may experience hyperprolactinemia. Xerostomia, or dry mouth, may happen 8 to 10% of the time, and 10 to 20% of patients may experience dizziness. 9 to 15% of patients may experience somnolence. Nasal congestion may happen 5 to 8% of the time, and fatigue may happen 4 to 6% of the time. Now, some more rare but serious side effects would be hyperglycemia, or high blood sugar, or a cerebrovascular accident. That's all we're going to talk about today with iloperidone or Fanapt. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.